cannot succeed. With that said, allow me to outline some of the key interventions we have implemented. Let me explain shortly that the distractions that in the conscience of most of our people here, with the falsified negative publicity that has been advanced by those that sought to gain personal interest and others in cahoots, Mr. Speaker. Mr. Speaker, numbers don't lie. They don't. And records, unless distorted, remain true. You go to the website of the Ministry of Health itself, not Kiambu County, in the Ministry of Health, the story of Kiambu's progress and achievement on health and matters maternal care is in the record of the ministry. Mr. Speaker, I dare those that have been spreading those to go to the website of the ministry itself and look at the record of Kiambu. Today, Mr. Speaker, we see more than 6 Speaker. We are running efficiently more than 123 medical facilities, Mr. Speaker. In the ministry's website, they have shown up from the top downwards to the list of those that have childhood mortality. Kiambu at the last four of the lowest, Mr. Speaker. And those the last four counties which are lower than Kiambu combined does not even have an attendance equal to only one facility in Kiambu, Thika level 4. Honorable members, from the onset of my administration, I pledged that no resident would travel more than implement these investments, suction machines have been distributed across various county hospitals, while dental X-ray machines have been introduced to strengthen dental care services. We have also made progress in renal care by installing dialysis machines. Thika Level 5 Hospital has now 5 fully operational dialysis machines, while Gatundu Level 5 Hospital has also been equipped with 5 dialysis machines. The dialysis machines in Kiambu Level 5 Hospital have been supplied and are awaiting installation. Mr. Speaker, sir, honorable members, when we assumed office, the emergency department in our health sector was limping. From a health emergency care that fully depended on hired and leased ambulances, today we boast our own 19 fully equipped, state-of-the-art ambulances that function as mobile ICUs operated by qualified personnel. The leased services costed Kiambu a total of 30 million per year in the past, which today is a saving plowed back to improve healthcare in Kiambu County. Mr. Speaker, we also have an ambulance dedicated exclusively to maternity care, ensuring that mothers and infants receive the needed care promptly. As a result, the Kiambu Level 4 Hospital achieved 0 maternal deaths between January and July of 2025, which was unprecedented in Africa. This notable achievement, Mr. Speaker, was recognized by the Federation of International Gynecologists and Obstetricians, FIGO, and at the just concluded 80th United Nations General Assembly, UNGA, in New York City, and the 2025 Devolution Conference in Homa Bay, Mr. Speaker. Mr. Speaker, anyone who was following the proceedings at the United Nations General Assembly in New York, the 80th session, just a few weeks ago, Mr. Speaker, had the name of Kiambu being mentioned on the floor of the General Assembly of the United Nations. And the mention was not about anything else. It was about an achievement that was not precedented as achievable in a developing country like Kenya. That goal, that mention, was that in 7 full months, Mr. Speaker, there was 0 maternal death. This story was also repeated, Mr. Speaker. This story was also repeated, Mr. Speaker, in our own parliament, in the Senate. It was a discussion and one of the markers of the success of devolution at the devolution conference in Homa Bay County, Mr. Speaker. And for the naysayers, Mr. Speaker, the facts cannot be changed. The history of the progress that we have made, Mr. Speaker, is clear. Noting, Mr. Speaker, honorable members, noting that infrastructure alone is not enough, we have also invested heavily in our workforce. My government has promoted 770 healthcare workers who had stagnated in the same job group for years. We are in the next cycle of promotions, targeting diligent and high-performing healthcare workers who are due for promotion. We have also employed 80 new doctors, 150 new nurses, and additional support staff to guarantee that this critical sector runs smoothly and without interruption. We have made it a continuous process to recruit more healthcare workers to address the emerging gaps. Currently, a recruitment of a new cohort of medical practitioners is underway by the County Public Service Board. I must recognize the dedication of all the medical practitioners in our 123 hospitals in Kiambu County and the more than 3,000 community health promoters for their continued and passionate service to our people. We were honored to host the National Nurses Week celebration, where our nurses were fitted for their outstanding performance. Mr. Speaker, on this issue of promotions, because one of the many issues that was raised as a contentious matter when members of the union responsible for the welfare of doctors approached the county government, and indeed, for purposes of the record of this House, that those issues that were raised to a county government, we would term them as historical. Mr. Speaker, the agreement that has been in contestation is important for us to clear to and the unions. Mr. Speaker, these agreements that are called the Mr. Speaker, were done when national government faced a strike way before this administration, way even before. And 60 of them who have been serving continuously for promotion among us. With all who can immediately recommend the right treatment. The system also enables our It also improves referral systems by eliminating the need to carry handwritten. It has been the norm and history in medical care in this country and this county that all the time, Mr. Speaker, when a patient goes to a hospital and they are diagnosed, upon them to carry with them a bag full of their examination records with them. The county, Mr. Speaker. I want to notify the members and to bring to the attention of our people in Kiambu that that is no longer the case in our county. That indeed, the diagnosis of a patient in any corner of this county can be diagnosed, it can be dispensed at any facility without carrying of physical records, courtesy to our hospital information management system. Mr. Speaker, we envisage a county where medical tourism will become a reality as we transform Kiambu Level 4 Hospital to a Karori to an ENT center, while Githongori will be an Speaker, this Kiambu Health Master Plan demonstrates our firm resolve to bring modern healthcare closer to constructed all the level 4 hospitals that I have enumerated this afternoon, Mr. Speaker. Some people that we have got and built 6 new level 4 hospitals atop the existing ones. We have a plan, Mr. Speaker. We want to make the journeys that our people make to India no longer journeys to India, but journeys will be to the Goto, Mr. Speaker, with the implementation which will ensure that any major